Joining me on the phone, a great friend of the show, Mike Coston. He is the owner of the blog Avian Flu Diary and a fantastic freelance journalist. Hi, Mike. How you doing today?
Hello, Robert. Good afternoon.
So glad to have you because I just cannot even keep up with this stuff, and I'm kind of hoping you have been.
Well, I'm trying.
Yeah.
There's a lot going. In fact, in the last 5 minutes, I can give you a hot off the presses flash.
Please.
Saudi Arabia has just announced 10 more cases.
All right. So let's talk about the numbers. To the best of your ability, how many confirmed cases are there globally at this point, and how many deaths? I mean, the best you can give.
We're somewhere around the 350 to 360 cases, and somewhere in the 95 to 100 deaths range. There are reports that we get from places like the UAE saying 7 more cases here, 5 more cases there, and they don't give us any details. So it's kind of difficult to know whether or not we've already heard about those cases before or if they show up in a later report. But the numbers, it doesn't matter what the exact number is. What matters is the trend, and the trend is that we're seeing more cases.
Sure.
Surveillance never picks up all the cases. So if I said there were 352 cases out there, I can guarantee you it'd be dead wrong, even if that were the official count.
All right. Well, but one thing is clear. In April, we've seen quite a dramatic spike.
Well, yeah, Dr. Ian McKay did a terrific graph earlier this week. In the first 18 months since MERS appeared on the scene that we're aware of, which was in Jordan 2 years ago, it took 18 months to have the first 100 cases detected. It took 6 months to get the second 100 cases detected. We've had 150 cases in the last 30 days.
That's really, really, really dramatic. And I mean, so dramatic that the WHO put out a statement very recently, and a lot of it is focused on human-to-human transmission. Did you cover that at all, Mike?
Yes, 75% of the recent cases are believed to be due to human-to-human transmission, as opposed to a primary exposure from presumably an animal, camels, likely bats possible, or contaminated environment, or fomite exposure is what it's called. Seeing a lot of healthcare workers. We're seeing an increasing number of mild or even asymptomatic cases, which is a good news, bad news sort of story. The good news is it means that if you get it, it doesn't necessarily mean you're in for a trip to the emergency ICU and a ventilator and that sort of thing. It's possible, but it isn't, foregone conclusion. The bad news is it means we're probably missing a lot of cases in the community that are too mild to go to the doctor or the hospital and be tested.
All right. Now this is the spikes appear to be, of course, in Saudi Arabia and the United Arab Emirates.
Yes.
And this affected Saudi politics in a way too. There's a new health minister.
Yeah, their health minister who had been in power for many years was removed from office after quite an uproar on Twitter about him and his policies, and a lot of international concern, too. There was a Washington Post editorial. There have been others out there. There have been blogs critical of the health ministry. But on, I believe, Tuesday, without any warning, the health minister was replaced with the Minister of Labor, who is not a doctor, who you would assume would not have the background to handle this, but he has done a remarkable job in the 3 or 4 days he's been at it. As far as we can tell, we're getting more information now than we have in the first 2 years out of Saudi Arabia. Long may it wait, We hope this continues.
Yeah, because the information coming out of Saudi for the longest time was just late and sketchy and non-specific.
The word I use in my blog.
What word?
Parsimonious.
Ah.
Yeah. But, we've gotten more good information in the last 3 days than I've seen out of Saudi Arabia in 2 years. And he has also chosen a well-respected virologist to be his advisor. This morning, He announced that they were setting aside 3 large hospitals, one in Riyadh, one in Jeddah, and one in the eastern provinces, as MERS treatment facilities.
Oh, wow.
So, he's actually doing what should have been done 3 months ago, 6 months ago, a year ago, and he's doing it, at a tremendous pace. I'm really amazed he's gotten done what he's gotten done.
Wow, that sounds really impressive.
It is. Let's just hope he isn't, a day late and a virus, short here, because this should have been done months ago.
Oh, well, Mike, now one of the concerns, of course, were for the different Muslim pilgrimages that go on in Saudi Arabia. There's, of course, the Hajj, and there's this other one called Umrah. Yeah. And there was always a concern that MERS could be an issue there. Well, it has become one, hasn't it?
Yeah, we've actually had some pilgrims doing Umrah in the holy cities end up returning home, most famously the one in Malaysia,
right?
Who died after he returned home, and there are still people quarantined in Malaysia. Luckily, we don't see any evidence of further transmission in that case, but we may not know because the incubation period can run up to 10 to 12 days. So we've already seen pilgrims. Now, there are 2 big religious pilgrimage times in Saudi Arabia. One is, of course, the Hajj, and the time varies every year. This year, it falls somewhere between the 1st and the 6th of October, and that's the big one. But there's a lesser holy time called Ramadan. And if you do your pilgrimage during Ramadan, it can serve as a substitute to doing the Hajj. And it's incumbent upon every able-bodied Muslim to make the Hajj journey at least once in their lifetime. So it's a big deal. The waiting list to do it is sometimes 10 years just to get the visa to do it. And so it's very difficult to ask people who may be in their 60s or 70s and needing to do this to fulfill, their religious duties, that you can't go this year. You've been waiting 10 years because there's this virus out here. Yeah. So politically, it's a real hot potato. Yeah,
not only politically, though, but I mean, if anybody that understands respiratory diseases, you get, 300,000 people together like that, you're potentially asking for a lot of trouble.
Yeah, well, we worried about it last year. It didn't happen. There's some talk about maybe there's something about the springtime with this virus, that there's some seasonality to it. It could have to do with the fact that camels often are birthed this time of year, and young camels are, immunologically naive to the virus, more likely to acquire it, more likely to shed it in large quantities. Maybe that has to do with how come we've seen basically an outbreak every spring for the last 3 years. But this seems to have gotten into the population enough that maybe we don't need to have camels reseeding it anymore. And that's the concern, that it's no longer just a spillover event with a few secondary cases, but this is, as it transmits through people, it acquires or adapts, it acquires changes and adapts to the human host, and at some point no longer needs to be reseeded. And that's the concern here. Has this got a foothold in the human population? And we're waiting to find that out.
Now, Mike, you did an interesting piece concerning the case fatality ratio and
yes,
and what it means, how accurate it is. Can you go over that?
We never know until it's over how bad any outbreak was, because it's often years later that they have done all the research. We're still trying to find out how many people were killed by the 2009 H1N1 pandemic.
Right.
The early numbers were obviously way off. The latest numbers I've seen is somewhere in the 400,000 range globally. And that's probably fairly close, but it's very difficult to determine. And it may be the subject of academic debate for the rest of my life, I'm sure. But what we do know is that of the cases we have detected, about 30% have died. Now, there are some in the hospital that we know about that may yet die, so that could drive that up. But there are undoubtedly other cases out there that have not been detected. They were too mild, never got tested or were diagnosed with something else, and they didn't die. And if you could factor all of those in, it would drive the CFR, the case fatality ratio, down. I think it's important to know that, we talk about a 30% case fatality ratio. That is horrendous. When you think about the great pandemic of 1918 that killed, anywhere from 50 to 100 million people,
right,
had a case fatality ratio in the United States of about 2.5%. And in Europe, it was less than 2%. Now, there were places like India and Asia.
It's probably higher.
Other places that had 5-10%.
Yeah.
But even then, nothing was like the 30% ratio. So we really think that the case fatality ratio of this is going to come down once we have a better handle on how many people actually have gotten sick or infected and not gotten sick.
Yeah, good point. Now, the one part of the recent MERS situation I have been trying to keep up on is the Philippines, and it appears that there was a flight that went there from UAE, and it appears that was a false alarm.
Well, it was apparently a healthcare worker who tested positive in the UAE
with some kind of a screening test, though, right? A nose swab of some sort.
And by the time he got to the Philippines and was retested, tested negative. Okay. Now, we don't know whether or not the Philippines test wasn't as sensitive, it wasn't taken from the right. I mean, sometimes you have to do a deep lung aspirate to get a decent test for MERS. A throat swab just doesn't always catch it.
Right.
It's also possible that he had been infected, he'd cleared the virus naturally and was no longer shedding virus, and therefore they couldn't pick it up by the time he got to the Philippines. We don't know a lot about how long somebody's infected before they clear the virus, and that obviously is going to vary from one person to the next.
Okay.
So my guess is he probably was infected, but he wasn't infectious by the time he got to the Philippines.
Yeah, because the institute that did the testing in Manila, the RITM, they are really, really pretty advanced in their technology.
Well, if he was still shedding virus in any quantity, they probably would have picked it up.
Yeah.
So my guess is that he was either mildly infected or his immune system quickly cleared it. They've already released 18 people from the hospital in the UAE who they say have cleared the virus naturally without treatment after being in isolation. So obviously, you can be infected and get well or clear the virus without the need for treatment, if you're lucky, in a matter of days or a couple of weeks.
All right. Well, Mike, I wish we had more time. We could do a whole show just on this topic. I mean, it's just mind-blowing what's going on over there.
We have an embarrassment of riches when it comes to infectious disease this week.
There's no doubt. Well, Mike, I appreciate you coming on. Mike Coston, Avian Flu Diary. I'm sure we'll be talking again soon, my friend.
Okay, Robert.
All right, take care of yourself.
Okay, thank you. Bye.